Do you or someone you know have an eye condition that might be leading to vision loss? If so, it can be very confusing to find good information about visual impairments and diagnoses. Today, I will be giving you information about 8 common eye conditions that affect adults, and you will learn about the causes, symptoms, and treatments to better understand your next steps. Hi, if we haven't met before, my name is Roxanne, and I'm a low vision therapist who has been helping people reclaim independence for the past 10 years. Here are 8 of the most common eye conditions that may result in vision loss during adulthood that I will list, and then we will go into more detail, so you'll want to stick around. First is cataracts. Second is age-related macular degeneration. Third is diabetic retinopathy. Fourth is hemianopsia. Fifth is glaucoma. Sixth is retinitis pigmentosa. Seventh is Stargardt syndrome. And eighth is Leber's hereditary optic neuropathy. There will be chapters listed in the description box below if you prefer to skip around to the different eye conditions in this video. First, here's a chance to share what you know about eye conditions in the comment section below. I will ask a question, and the answer will be one of the 8 eye conditions I listed. A countdown timer will be running to give you time to guess or type your answer. And then I'll give you the correct response with details about each of those conditions. Okay, ready? Here we go. Which eye condition is most common overall? If you guess cataract, that is correct. Here are 3 other things to know about cataracts. Cataracts affect the lens inside your eye. Cataracts cause a smudgy or hazy look over what you see. Cataracts can be removed, and it's one of the most common procedures to restore more clear vision and prevent blindness. Here is the next question. Which eye condition is the most common over the age of 65? If you guessed age-related macular degeneration, that is correct. Here are 3 other things to know about age-related macular degeneration. Age-related macular degeneration occurs in the macula of the retina inside the back of your eye. It may cause things to look blurry or wavy with blind spots in the central vision. Age-related macular degeneration may be improved with special eye injections or vitamin formulas. It greatly impacts daily activities. Yet, by itself, age-related macular degeneration does not lead to complete blindness. Next question. Which eye condition is most common in working age adults? If you guessed diabetic retinopathy, that is correct. Here are 3 other things to know about diabetic retinopathy. First, it occurs throughout the retina inside the eye. Diabetic retinopathy may cause things to look blurry or foggy, and there may be many floaters or blind spots. Diabetic retinopathy may be improved by controlling blood sugar levels. Because the longer someone has diabetes, the more likely they may be to develop diabetic retinopathy that can lead to blindness. Next question. Which eye condition may be the result of a stroke? If you guessed Hemianopsia, that is correct. Here are 3 other things to know about Hemianopsia. First, it occurs in the visual processing system of the brain due to a stroke or a traumatic brain injury that interrupts the signals. Hemianopsia may cause halves or quarters of objects to seem completely missing. Hemianopsia may be addressed with vision therapy. However, rehabilitation techniques focus on scanning and other strategies for safety and daily activities because there is no cure. Next question. Which eye condition may be more common over the age of 40 for African American, Black, and Latino men? If you guessed glaucoma, that would be correct. Here are 3 other things to know about glaucoma. It affects the optic nerve inside the back of the eye due to a high intraocular pressure. Glaucoma may cause things to look blurry, but most noticeable are the reduced peripheral vision or side vision. Glaucoma cannot be reversed, but it may be controlled with special eye drops that can stabilize or slow the progression of the disease before it leads to blindness. Prevention is the greatest factor with glaucoma by having annual dilated eye exams, especially if glaucoma is common in family members. Next question. Which genetic eye condition often progresses slowly throughout adulthood? If you guessed retinitis pigmentosa, that is correct. Here are 3 other things to know about retinitis pigmentosa. First, it occurs throughout the photoreceptors of the retina inside the eye. It may be diagnosed in adolescence or early adulthood. Retinitis pigmentosa may cause color perception to be impacted, but most noticeable are the reduced peripheral and side vision field of view, even if the remaining vision seems clear. Retinitis pigmentosa may also include hearing impairments called Usher's syndrome. Retinitis pigmentosa cannot be reversed and it has no cure. However, because it is a genetic condition, there are often clinical trials that are happening, and I will leave a link in the description box below to find out more about those. Next question. Which eye condition is often diagnosed in childhood or early adolescence and is referred to as juvenile macular degeneration? If you guessed Stargardt syndrome, that is correct. Stargardt occurs in the macula area of the retina. and generally progresses throughout adulthood. This can mean that people with Stargardts often miss life development milestones, such as learning to drive with a permit as a teenager. Stargardts may cause extreme light sensitivity or color perception to be affected. However, most noticeable are the growing central vision blind spots. Stargardts has no cure and cannot be reversed, but it is genetic, so there are several clinical trials that may be available for participating. And again, as I mentioned, that link will be listed in the description box below if you would like to find out more about those studies. Final question: which genetic eye condition often goes undiagnosed until sudden vision loss in adulthood? If you guessed Leber's hereditary optic neuropathy, that is correct. The first thing to know is this eye condition is often abbreviated LHON. It occurs at the optic nerve area inside the back of the eye due to mitochondrial disease. And although it may be diagnosed in early adulthood, often it is not, especially if other family members have not been identified with the genetic markers or symptoms of this eye condition. LHON causes blurry vision and may impair color perception, but most noticeable is how rapidly the blind spots progress. LHON has no cure. However, there are medications in development according to the FDA. Rehabilitation focuses on devices and strategies for independent living. Also, because LHON is a genetic condition, there are clinical trials available, and that link will be in the description box below. Whether you or someone you know is experiencing one of these eye conditions, I encourage you to find specialized care and services. If you would like me to send you a custom resource list of your area at no cost, there will be a link in the description box to fill out a form for that request. To learn more about being diagnosed with a low vision condition, here is another video you can click on to watch next. Take care until next time, and remember, less sight does not equal less light.